Okay, we have now attached our monitoring equipment to Isabel. You can see that she has a pulse oximeter probe on her tongue, and this emits infrared light that is able to penetrate through the skin, and it measures, it reflects off of blood that has, of the hemoglobin in the blood that has oxygen attached to it. And by doing that, it gives us a percentage of blood that has oxygen attached. In this case, with Isabella, she is 90% oxygenated, and that's fantastic. Anything above 95 is very good. So virtually all of her blood has an oxygen molecule attached to it. She's doing great as far as that's concerned. We have also attached to her a blood pressure cuff, and what this is going to do is perform an indirect blood pressure. It's going to give us a systolic rate, a diastolic rate, and then calculate a mean arterial pressure. And those numbers are seen right here, and right now her pressures are fantastic. Her systolic rate is 139, her diastolic is 85, her mean is 107. Any mean over 60 is great. So we're almost double of where we want to be. That's fantastic as well. The machine is also keeping track of her heart rate. Right now she has about 180 beat per minute heart rate, which is fast. She's a very excitable dog. A dog her size, expect to see it closer to 100 or so. So I think as she relaxes under anesthesia, we're going to see that decrease. And she just got an injection of a non-steroidal anti-inflammatory that is going to help reduce post-operative inflammation and pain. And it looks like we are getting her down to a surgical plane. She might be a little bit light. So we're giving her some breaths. We're forcing her to get some nice good breaths of oxygen mixed with our isoflurane inhalant. And we're going to make sure that we get her down to the plane that she needs to be at. We're double checking our lung sounds, making sure that they do truly sound the way that we want them to sound. Excellent. Great. So now we're going to roll Sophie over onto her back so that we can, not Sophie, this is Isabel. The other one is Sophie. We're now going to roll Isabel. We're now going to roll her onto her back so that we can start getting her prepped for her procedure. All right. So now she's rolled over, so we have her now in what we call dorsal recumbency. Your dorsum is your back, your ventrum is your chest, so is the dog's chest, so she's now lying on her back, and that's called dorsal recumbency. And one of the things that we want to do before we perform the ovariohysterectomy, the Spay procedure, is express her urinary bladder. We don't want that to be in our way, and Wendy is getting a diaper there ready to express her bladder. And she is very good at abdominal palpation, so she's going to feel for that urinary bladder, and once she gets a hold of it, she's going to put constant pressure on it until she's able to overcome the urethral sphincter, and we will have all of that urine come out of the dog's bladder. The urinary bladder is a compliance organ. It is made to stretch and to shrink all the time based on how much you're drinking and what your overall body fluid status is. So you can put a lot of pressure on it. As long as it's healthy, nothing bad will happen. It won't rupture or pop or anything like it. There we go. The seal is broken. There we go. Oh.
Good Lord.
And she did indeed have to go. There we go. All right, that is one express bladder. Excellent. So we don't need fur, hair in our surgical field, our surgical incision. We're going to clip the fur, the hair, off of, the hair is actually the correct technical term. We're going to clip that from the curve of her ribs all the way down to her pelvis, to her pubic bone, and then laterally out on the side so that we've got a nice little generally rectangle shaped hair-free zone that will perform our procedure in. One of the other things that we're doing with, while Dana is running anesthesia, is she's going to maintain an anesthetic record, and that is going to be a legal document that shows all of her readings that we had throughout the procedure. And this way, if there is an issue, we have a document where we can go back and look at what went right and where mistakes or errors could have been made, and we can do things better. And sometimes we find that there's a good explanation for things, and sometimes we find that there is not. But we're going to maintain that as we go throughout the procedure. So we're clipping her hair, and you can see her foot twitching right there. That is a cutaneous response. She is not aware mentally that her foot is kicking. She has a little itchy, ticklish spot on her abdomen, and whenever the clippers touch that, just like if you get tickled, it makes her foot kick. And it wouldn't really matter how deeply anesthetized she was, her body will still do that. That is a cutaneous nervous response. And you can see now that Isabel has been anesthetized for about 5 minutes or so, we can see that her heart rate is starting to decrease quite a bit, and so is her blood pressure. She's much more relaxed now. Her heart rate was 180. It's now down to about 150 beats per minute. Her blood pressure has also reduced down to 105/52. Her mean is now 77, so she is definitely relaxing. She's getting less vascular tone, and we're getting her close to a surgical plane of anesthesia where she will have nice steady vital signs, but will be completely unaware that anything is happening to her as the procedure goes on. So we have finished clipping the hair off of Isabel, and now we have our surgical field that we are going to work out of. A couple of landmarks that are important for the Spay procedure are the umbilicus and the pubis, which is part of her pelvis. She is a mature dog. She's about 2 years old, so because of that, she's going to have a larger uterus than if she were a puppy, and her ovaries are going to be sitting way down here near her kidneys. Because of that, we're going to make our incision in the cranial part of her abdomen, about from her umbilicus to down between these this set of nipples here. So we're going to end up with an incision about 1.5 inches, 2 inches long on her. If she were a younger dog, an immature dog, their uterus and ovaries sit closer to their midline, closer to the middle of their body. And in that case, we would make our incision more in the middle of her abdomen, and that would give us the access that we would want. The next thing that we are going to do is prep her abdomen, again with our chlorhexidine and alcohol, just like we did with the catheter site. This is called our initial prep. Some people call it the dirty prep. And what this does is remove the surface dirt, bacteria, and grease off of her skin, so that we can then, when we move into the surgery suite, we can then perform an aseptic surgical prep. That will be the final step before we begin the operation. Let's shift our focus over to our other dog here. So we can see that we are again anesthetized already. We've placed our intravenous catheter. This dog is going to be castrated. So we're going to remove both of his testicles. First thing that we're going to do is again clip the hair from the scrotum to the end of the prepuce and out on the sides. And we want to, as we're doing our prep, we want to make sure that we do not damage the skin of the scrotum at all. That is very, very sensitive, and if that does get clipper burn or cut into or irritated, it will really bother him post-operatively, and he will tend to do a lot of licking and chewing and causing trouble for himself. So we're going to be very cognizant of that as we perform our clip. So what I'm holding here while we're clipping, this is an esophageal stethoscope. This is another piece of monitoring equipment that we have. This is going to be inserted into the dog's mouth, down into the esophagus, and it will then rest in the esophagus at the level of the heart. And we will attach a set of earpieces to the end. And when we listen with the earpieces, we are directly then able to listen to the dog's heart with every heartbeat. And this is one of the checks that we have to confirm that our monitoring equipment is reading a correct heart rate for us. We always double check that by listening with our own ears. We never put all of our faith in a machine. We are now clipped for the procedure. And you can see here that we have not clipped the hair off of the scrotum itself. We've left that alone. We are going to, in a mature dog, we are going to perform a pre-scrotal castration. And what that means is that when we are in surgery, we are going to mobilize one of these testicles, both of them eventually, into the area just in front of that scrotum. And we're going to make our incision cranial in front of the scrotum so that we do not irritate that tissue at all. We're going to perform the same type of a prep with chlorhexidine and alcohol on this dog as we did on our other dog, and then we will roll into the surgery suite.